Treating your need for healthcare news, we are NHE. News, views and insider truths from the heart of the healthcare sector. We are the NHE team. I'm Emily.
I'm Matt.
I'm Ilsa. And each episode we will connect you to the people behind the UK health sector, sharing insight and innovation.
This podcast is brought to you by Evo North, uniting leaders from the public and private sector to collaborate, share exciting innovations and build a stronger northern powerhouse together. Welcome back to the National Health Executive Podcast. In the sort of hosting department today, obviously I have myself, Matt, and I'm joined by Ilsa.
Hi.
And on the other sofa across from her, we have Henry Jones, CEO of Big White Wall.
Hi.
So welcome to the show, Henry. We really appreciate you being here. And I suppose we'll jump straight into it. So sort of for readers who maybe don't necessarily know what the Big White Wall are, could you explain a little bit about yourselves, what you do?
Yeah, I can. So we are a digital service for people with anxiety and depression.
Yeah.
We offer a 24 hours a day anonymous, safe platform that is 24 hours a day moderated by clinicians and counsellors. We have a team in New Zealand, UK and Canada. And the platform offers a peer-to-peer community, so the ability for other people to talk with other people like themselves, other groups, to normalise their feelings, get tips from each other, chat to other people. We also, as part of the platform, offer courses. Those could be either clinically led by a counsellor or a clinician, or they could be self-guided. And then we offer a series of resources, so things like assessments, tips, tools, tool sheets, etc., really to help people try to manage and deal with their own anxiety and depression. Currently we have over 120 organisations that commission us. That includes NHS trusts, CCGs, local authorities, the Ministry of Defence commission us for that serving army and all services. We look after the veterans. We have a number of universities, charities and employers who also use us. And in the last 12 months we've supported over 70,000 people, which
Amazing.
is up on 50% the year before.
Yeah, incredible.
So it's growing fast.
Definitely.
So as you've just said, Big White Wall are all about utilising digital technology and the online space to help improve people's mental health. Is it pleasing and good for you to see digital innovation being such a focus on the healthcare industry at the moment?
Yeah, so look, I've been in technology for over 20 years now,
Yeah.
technology businesses in different verticals, and in fairly traditional verticals such as construction and legal services.
Yeah.
And you know, for me, a lot of those businesses have a lot of similarities in terms of challenges around productivity, demand and supply, access, and healthcare absolutely has those issues. So I think it's really nice to be using those skills and experience in something that is so important to society. I also think that, you know, that there is, I think about 10 years ago, I think, you know, being in technology was probably very sexy and cool. Now technology is getting a lot of bad press.
Yeah.
You know, technology is bad. So it's really nice, and you know, we are a social impact business that's specifically been set up to address a societal issue, mental health. So it's really nice to be part of a business that is doing tech for good,
Yeah.
and that's cool. And then the final thing, which I really love, is, you know, one of the things that technology is accused of is about causing isolation.
Mm-hmm.
So sort of people back away from society. About 50% of our users say that our platform has helped reduce their own isolation. So it's really nice to see technology doing the thing that, one of the things it's accused of causing, and actually addressing those issues.
Yeah, I suppose as you say there, it's sort of nice to hear a positive narrative for it whenever people hear these days technology and mental health in the same
community
sentence.
or technology and community, it's like, it's awful.
They're always scary sentences usually,
Yeah.
especially, I mean, from the media side on this point, we don't tend to get it right or hear nice stories like it. So it's certainly a sort of positive to hear.
And I think on that note, you know, it's really interesting. We looked at a few of the three most well-known social media platforms, and currently there are about 6 million people using them to talk about mental health.
Yeah.
And I quite frankly think that's really inappropriate. They're not safe, they're not moderated, and there's been some very well published very bad outcomes
Yeah.
of that happening. So, using technology in a really good way is nice. And we don't sell, we will never sell, we don't own anyone's data. So all of those good things are core to what we do.
Yeah, and sort of as we touched on, the company's sort of being, it has such a wide scope and stuff. Yourself as chief executive, you stepped in this role, I believe it was just over a year ago.
Yeah, that's right.
January 2019. So what has that process been like? Obviously, you came from very different verticals all across the scope.
Yeah. So look, so I got involved with the business before. When I got involved with Big White Wall, I really started the conversation with Big White Wall a good 6 months before I actually joined. So I think the company did a fair bit of due diligence on me, and I did a fair bit of due diligence on the company. And so what I saw before I even came in, as I knew there was a team that was very dedicated and good. We had an amazing, unique service to address one of societal problems. Technology was a bit old, but basically there were no real surprises when I came in, because I got the privilege of actually having a really good look around, and likewise they did on me. Having said that, it's been intense. It's been a very intense year. We have had a lot to do. We rebuilt the management team. Yesterday we just went live with our new technology platform that has taken us 14 months to rebuild. So we completely rehauled our technology. We raised some extra investment. So it's been quite an intense year. No surprises, but a lot to go. It has also been, it's been a great year. In the last year, I talked about having 120 commissioning organisations. We added 50 in the last year, so we went from about 70 to 50. So we've seen amazing growth and amazing feedback, and it really feels now is our time. Look at all the headwinds of what's happening in the press, what's needed, the mental health, and the feedback we get on the services we provide. It's very exciting.
Yeah.
So your career background has been from a more digital scope with vast experience in services and technology companies, which presumably gives you a slightly different outlook to others about how we best tackle certain challenges. So how important do you think it is to have that diversity of experience and thought processes within healthcare?
So look, I've worked in technology. The last two businesses before that, one was in legal services, one was in construction. If you look at the leadership of those businesses, and I have never been a lawyer, and I've never been a builder, and I've never been a doctor, but if you look at the leaderships of those businesses and what made them so hugely successful, is I think you saw a combination of people who know the space, and a combination of people who bring other expertise, so maybe technology, maybe experience on what's happened in other much similar situations. So I think that diversity is really important. And if you look at the leadership of Big White Wall, you will see that what I think is very complementary. Different combination of skills that come together. I don't think, that combination of expertise is really important. And a lot of the challenges I think you see are actually surprisingly similar. The industry is obviously unique, but a lot of the challenges like access to services, demand, productivity, they're very similar. So learning from each other, I think, is ultimate. And I think any industry, it's not just healthcare, any industry needs to be big enough and go, actually, what are they doing in other similar industries? What can we learn from other people?
Yeah, I mean, we sort of hear it so much from ourselves about sort of learning from other trusts, learning within the healthcare, but as you say, actually broadening that and bigger picture, there are the same issues across the field, so that diversity of thought is huge to be able to bring different challenges to it.
Yeah, I strongly believe that, and as I say, it's exactly how we are building our leadership team, is to bring those complementary skills, and what I have seen successful before.
Certainly, and obviously, as is quite apparent as we keep talking, Big White Wall, you are set up to support mental health. You're set up to support it in a very unique manner, but the mental health sort of scope entirely is still overarching across everything. From your point of view as yourself and the company, what sort of challenges have you seen, or do you see are the biggest challenges at the moment?
For mental health in general, I think it is demand for support is growing. and we've got to get a handle on it. I think the long-term implications to our society and individuals are very bad if we don't. Someone I was talking to, I used the impact of the sugar crisis on youth and obesity will pale into insignificance for the impact that mental health will cause and that our youth is going through now, unless we can find ways to address it. So I think it's really important. I think the other problem is that although some good progress is being made and there's some initiatives that seem to be working well, we ultimately have what I call a broken model.
Yeah.
Demand is outstripping supply so much that unless we change the game, we are going to lose. And so for me, it's about, we've got to understand the model, we've got to have treatment, we've got to focus on prevention, not just treatment. We've got to have metrics that focus on prevention, not just treatment. And we've got to really start thinking about different ways to do it. So I think our biggest problem is that demand. We just cannot meet the demand with the traditional ways of doing it. And anyone who tells you can, I think is wrong.
Yeah, and it certainly sort of tracks with things we've heard and expertise we've had in our print edition in recent months. I remember not so long back in one of our editions we had a report into CAMS and CAMS access of the same, and the sort of difficulties there. I believe they had stats of 25% or so were not able to access it just purely because of the demand.
You just look at iApt. So iApt is great. Okay, it is absolutely great, and I think it's a great service, but it is only reaching 20% of the people it identifies that want help. So it is doing an amazing job, and I don't know the figures, are helping 2 million people a year, up 1 million on before, but there's still another 8 million who are not getting services and people waiting. So it's just this challenge it's an overwhelming challenge, and that needs to be addressed.
Yeah, and I suppose that's addressing it through not just, as you said, the traditional means, having these sort of different pathways, these different ways to support, such as what yourselves are doing online. It gives that sort of different approach to the traditional mental health service based in a hospital and such. So I imagine, as we've sort of would agree, the biggest challenge is the demand, and tackling that is getting a broader scope.
Yeah, and I think we're in the proverbial, we've got a hole in the boat, and it is letting on water quicker than we can bail it out. And unless we find a way to make that hole smaller, we're going to sink.
Yeah.
And that's what terrifies me. And I think that if we can find ways to provide tools to allow people to self-help themselves or help each other, we will have a chance of doing this. But we will never have the resources to do this in traditional ways. So I often talk about this concept of a one-to-many versus a one-to-one model. Health services generally have operated in a one-to-one model. You go and see your doctor, you go and see but actually the scale of the problem is so much, you need to be able to have one clinician servicing many people. We have built a very rigorous, safe model that allows us to have a handful of clinicians monitoring a community of thousands of people.
Yeah.
So it's that sort of dynamic that makes a big difference.
Yeah, it's sort of, as much as you hear the one-to-many, it seems to be the scary thing in healthcare of like, oh no, we need more healthcare for individual people, but actually it's using it efficiently that you can.
Yeah, and I think this goes to the hole in the bucket. I think you will always need the one-to-one.
Yeah.
And those are really important. And I'm not saying that you can get rid of that. I think there are many different solutions that need to come together. And they're absolutely a critical part of the care pathway. But those resources are scarce and they need to be used where they're really needed. Where there are opportunities to use other resources to reduce that hole in the bucket, I think that is what's going to make the difference. So you need a bit of everything. You will need, it's not going to be, there is no silver bullet.
Yeah.
And technology is certainly no silver bullet. It enables you to do things in different ways and change the game slightly, but it is not a silver bullet to a crisis.
Yeah.
So there seems to have been a real change in thought around mental health recently, with less stigma attached to it. What are your thoughts on this, basically?
I think it's great. I think there are at the heart of what we're doing is putting people in contact with people, and that it is proven through many different studies and nice guidelines is that communities help each other. So getting people to talk to each other and help each other is absolutely great. And one of the ways we encourage that is through reducing the stigma. So I think it's really important. I would caveat that with, look, 2/3 of the people who share on our platform, which we can show has a significant impact on people's wellness gains, so how better they get, the outcomes. So 2/3 of the people who share do it because they say it's anonymous.
Yeah.
Okay, and I think there is it's a really interesting dynamic. One of the things that we strongly believe is that the earlier you can catch someone, the more chance you have of putting them down a pathway.
Yeah. Mm-hmm.
And if someone is sitting there going, I'm not ready to share, I'm not sure I want to share, giving them a safe place to start that conversation is a really powerful thing. And actually, one of the outcomes we see a number of our people say is, well, because of my experience on the platform, I'm now willing to go and talk to family and friends about it and start sharing it. So I think we're all doing the same thing. I think smashing the stigma is really good. The other thing I will say, it's a bit easier to smash the stigma if you're a CEO of a big business and you're sitting, you're quite comfortable, than if you are a squaddy in the army starting your career and scared of your captain.
Yeah.
So I think we got to, so I'm all for it, but I'm not sure it is the silver bullet either.
Yeah, it's one step of many to sort of get to the end.
And we should absolutely be doing more and more we can to smash the stigma.
Yeah.
But I don't think it is the only answer.
Yeah, no, certainly, and even smashing it, as we sort of hear this, we tend to smash the stigma, but it's the societal one. As you say, a lot of the response you have are comfortable initially because it's the anonymous aspect to it. So it's sort of making that comfort there as well, which is a lot longer and harder of a process, I imagine.
And I think you'll see a lot of the people who use the platform, one of the things that cause them stress and anxiety is they have issues or problems that they don't want to share with family and friends.
Yeah.
That makes it worse. So
Yeah.
there's no out there.
It just
If you
fuels
sort of
it even more.
I don't want to share. It could be a sexuality issue. It could be a bullying issue. There are loads of different things that actually are really hard to come out with.
Yeah.
And actually, it's not that they're worried about sharing they've got anxiety.
Yeah.
They're worried about sharing the underlying factor of the anxiety, if you see what I mean.
Mm-hmm.
Yep.
Certainly. I suppose, sort of, as we touched on there, as we go forward and we try to improve and sort of improve mental health care for patients, what do you think sort of the biggest change or improvement has to be? Obviously, we've talked that there isn't necessarily a silver bullet for it, but sort of what are the key areas you'd say?
I guess, in danger of repeating myself, I think it is, we have to increase investment, we have to set goals, we have to provide services, we have to create rewards around prevention. So, it's really interesting. I'm new to the space. One of the first things I had done is go and talk to people, customers or people in the NHS. And one thing you will hear time and time again is we are not rewarded or gold for preventing illness.
Yeah.
We are only rewarded and gold for treating illness. And that is a real problem.
Yeah.
Because actually it basically says, and you will see this again and again, it's all sort of like, until you're really ill enough, don't come to us.
Yeah.
But actually, if you could get them before, so then it would be brilliant. So I think that is our, that is my thing that I would champion really, really hard. I do think the other thing, and I heard something really interesting the other day, which I'm sort of starting to get my head around, is, if you look at the time, if you're ill, and you look at the time you sit in front of someone, whether it be a doctor, a therapist, or whatever, and then how much time you actually sit not in front of them, 96-7% of the time you're on your own. And most healthcare improvement has been focused around the time you sit in front of the doctor, not what you can do with the rest of that time. So I think this, and I think a lot of people are starting to do it, how can people help themselves?
Yeah.
How can people help other people to use that huge chunk of time more equivalently? I mean, if you improve that slightly, it has amazing power. So I think there is, and I think there's a lot of investment focus on this, but I think this continued, how do you help people help themselves? And we have a strong, belief in our platform about being very patient-led. In other words, we don't put them on a pathway. We'll make them aware and we'll signpost them. If someone's come on a chat room to talk about issues with alcoholism and stuff like that. We'll make them aware that there's a course, or they can sign up to a course, or there's some materials around, but they can do whatever they want. And I think empowering people to own their own care and make choices and give them the tools to do it is a very powerful thing to do, because, as I say, there is no way ever that if we go down any other route we will have enough resources to provide the level of care that people want and deserve.
And I suppose there's also that element that if it's their choice to engage with these stuff, people stick to a lot more. They do treat it in that 96% of it. It's not just for the 3% where I've got to prove to the doctor, the therapist, whatever, that I am making progress. They want that change. Yeah,
I think that's spot on, and I think, you know, especially, you know, one of the pivots that I think needs to happen in society, which it is starting to happen, is this view that I don't need to go to a doctor necessarily to get help. And you know, dare that being, you don't want people going onto social media diagnosing themselves, which is sort of when that causes issues. But, you know, if you can give me the tools, I think people will be prepared to do that much more. Whereas I think historically it's sort of like, well, I'm ill, I must go and see a doctor.
Almost makes it less daunting for some people as well.
I think so.
Yeah.
And you know, I mean, I've got young children. You know, where do they go if they need support? I would love to say they came to me every time, but probably they're going to social media, the first point of call. And that in itself is terrifying, because if it's not moderated and safe, it can be a very, very scary place, and it can cause some very bad outcomes. So I think we're grappling with all of this. But
we're sort of finding that necessary space sort of in the middle between the wilds of social media and the digital space and the traditional, I suppose, infrastructure, the establishments that are there, sort of setting up this sort of middle ground, which I suppose is a big part of what Big White Wall do. I know you mentioned at the start of the show you'd gone through this 40-month to improve and sort of revamp your platform stuff, so I suppose we'll give you a bit of time to talk about that as well if you wish.
Yeah, so I think, you know, we touched on this earlier. I think that when we haven't gone public with this yet. We did a soft launch yesterday, so you're probably the first people to hear about it. But
fab.
Anyway, so there you go. But no, so when I came on board, when we were looking at the business, and we were sort of like, how do we refresh it? I think it was clear. You know, we've been around for a while. The technology was old, and whilst people actually, you know, the feedback on the service was it's amazing, you're slightly looking and going, well, the technology is not very good.
Yeah.
And then the technology also had other limiting factors, like, you know, people are really interested in analytics and reporting now. When it was built, it wasn't really built for that. And the other thing we are really, really focused on, and it goes to sort of talking about what we're doing, is healthcare pathways and ecosystems. So we are not the silver bullet, but we believe, something that can be very valuable in a healthcare solution. So I sometimes talk about us as the Intel chip in the laptop. We're not building the laptop, we're building something that can be really powerful and make a difference. And so part of the rebuild of the technology was to enable it to fit into other people's care pathways. So whether you're an NHS trust and you're building, or you're a university building in an online ecosystem, or you're a private organisation, we can actually plug into that and enable it to be part of the pathway in a very cost-effective and scalable way. And so that's really where the focus of the technology has been. It is, you know, our technology is interesting because the bit that everyone sees is the front face, but it's a bit like an iceberg, because that's probably about 20% of the technology. The real secret sauce is what the clinicians use to make sure they can manage and keep safe and use logarithms and stuff like that to track and manage a large community, to make sure they can identify risk and manage it, etc. So that's a really big part of the technology, which you would only see if you came on, were one of our clinicians and counsellors. So it's been 14 months of work. We are, you know, and yesterday we went out there to the community. So it's like I was liking it, we were all living in one big office over here, and yesterday I got them all to walk over the street to the next new office. And Touchwood, it's someone, I was talking to one of our guys, he said it feels a bit like Y2K. We've all been so worried about it, of all things that could go wrong. and Touchwood, nothing has gone wrong so far. So it seems to be working and done that. But it's definitely aged me a lot the last few days. So that's where we are.
So always the way, but we certainly hope it all keeps going well and smoothly as well, because it's a valuable part. And as you say, it's one valuable part that can be collectively with the rest of the healthcare scope a really big, important sort of driving force throughout the I suppose future, for want of a less dramatic way of saying it.
Yeah, no, I do think we can have a real impact on society, and you brought up the question of being in technology space and building businesses. Is really nice to be able to have an impact on the construction industry and the legal industry and all of those things, but it's much more fulfilling to have an impact on the health of society. And it's sort of why I signed up, really. So, and I think why probably all of the Big White Wall staff are doing what they're doing is because they believe in the mission. So it's good.
No, amazing, and I suppose that sort of nicely rounds off to a great message to end on. I know from myself, and I'm sure the same for me also, it's been great to hear from you, great to sort of talk about a sort of side of mental health people don't necessarily always see or get to hear about. So yeah, a really big appreciation.
Yeah, thank you very much.
No, it's good. It's nice to talk about it. So thank you very much.
This podcast is brought to you by EVO North, uniting leaders from the public and private sector to collaborate, share exciting innovations, and build a stronger northern powerhouse together.
Join the chat on social media using the hashtag WeAreNHE, or send us an email via the link on our website. If you enjoyed today's podcast and discussion, don't forget to subscribe or give us a rating on whatever streaming service you're using. Thanks for listening. See you next time.